Hello, I'm Debbie Ellis. I'm the Infant Feeding Coordinator for Rotherham Hospital. I work with mums and babies and I also work with expectant mums as well. So today we want to talk to you a little bit about skin to skin and expressing. So skin to skin, we recommend all mums in Rotherham to have skin to skin with their babies shortly after birth, straight away after birth, because we know that this is a lovely way to say hello to your babies. It's also really important for keeping babies warm, regulating babies' heart rates and breathing, and it also helps calm babies and can lead to babies' first breastfeed. So thinking about expressing, most mums can express their milk in pregnancy. We would only suggest that this is done from about 36 weeks onwards. Colostrum is the first milk that you produce, and you will continue to produce this until after the birth of your baby. So breast milk will help your baby grow and develop, but it also helps protect your baby against any infections and diseases. Learning to express your milk in pregnancy can be a really useful skill for lots of reasons, as this can help boost your confidence when starting to feed your baby. It can also help ensure that your baby receives only your milk. And the other thing is that for mums who've got diabetes, can be especially useful, as these babies are at risk of developing I shouldn't say that again.
Yeah, you can go back a bit.
Is that all right?
Yeah.
Okay.
That's good.
It's especially important for mums who have got diabetes, because these babies of these mums are at risk of developing low blood glucose levels. This is hyperglycemia in the first 48 hours. And colostrum helps stabilise babies' blood glucose levels. So a mum who's expressed her milk in pregnancy may not need to use any formula when feeding her baby after the birth. So we talk about hand expressing, and this is really important because colostrum is really quite sticky. I'm going to go through how you actually hand express, but the way that you hand express helps to milk the milk out of the breast. Because colostrum is sticky, it cannot be sucked out quite as easily. So we have our breast, okay? And what you will need to do before you start expressing is think about your baby and be quite relaxed in yourself for this to be able to happen. It may help to do this and practice this whilst you're in the bath or the shower. So we would first of all encourage you to massage around the breast. So you need to go all the way around because you're stimulating all the breast tissue. So I would do this for a few minutes. The next thing you would need to do is stimulate your nipple. So this is roll your nipple between your finger and thumb, and this will help get hormones in action for you to be able to start getting the milk out. The next thing is make a C shape with your finger and thumb and place it about 2 to 3 centimetres just behind your nipple. So behind the base of your nipple, go 2 to 3 centimetres back, and then what you need to start to do is just compress. So compress and release, and start to do it in a rhythmic action. What you will then find is that drops of colostrum will start to collect just at the end of the nipple. And at this stage, you can either use an oral syringe that your health professional may have given you, or you may be able to collect in a little dish. When it starts to drip, continue to collect the milk, and then as the milk stops flowing, what you need to do is then move your fingers around the breast to a different direction and compress again. So compress and release, so you're compressing and releasing it in that rhythmic action, and the milk will continue to drip, so you will continue to collect at this stage with either your little dish or your little syringe. You may have to change hands at some point so you can access different parts of the breast. What we do say is avoid sliding your fingers, because this can create friction and you may end up hurting yourself. So when the flow is actually slowed on one breast, what we would suggest you do is that you start on the other breast, and we start again with the massage for a few minutes all the way around the breast and then the nipple rolling, and then repeat the process that I've just been through. We suggest that you do this once daily and start from about 36 weeks and gradually increase it to about 3 times a day. So, and the other thing to think about is that towards the end of your pregnancy, what you may find is that your bump naturally goes hard and then softens again. And this is quite normal, and it is what we call Braxton Hicks contractions. This may also happen whilst you are expressing. And if that happens, what we would suggest is that you stop expressing at that time and try on another day. However, if the contractions do continue, we would advise you to contact the delivery suite. So how do you collect your milk? We've collected it in these, or in a little syringe. So if you've collected it in a little dish that you may have at home, it may be an egg cup, it may be a teacup, it needs to be something that can be sterilised. You would need to draw it up, and that way anything that you've collected, we would then suggest that you put a little bung on the end of the syringe, then place it in a plastic bag or a plastic container. Remember to put your name on, the date and the time that you've collected. Place it in the bag and then store it. Colostrum can be stored in the fridge for around 5 days, so that can be a few days before you come into hospital, or you can actually store it in the freezer for up to 6 months. Remember, when you come into hospital, you will need to bring either your chilled or frozen colostrum in a cool bag with an ice pack, and remember to tell the midwife who's looking after you that you've brought it in, so then we can store it safely within the hospital. When you see your health professional in the hospital, you may be given one of these, which is something that we call the liquid gold pack. It's got a little booklet in that talks about all different things about breastfeeding. It's also got some oral feeding syringes in, which is what you will collect your breast milk in, or you could actually collect it in the little pot that's in there. It's also got some little bungs to put on the end, so you can put it in the freezer and ensure that there's no loss of any milk from the syringe itself.